Hi everyone. Today in this video let us discuss one of the medication, Doxepin. What is this drug Doxepin? Doxepin is classified as antidepressant. It is one of the tricyclic antidepressant commonly known as TCA. This drug is used for the treatment of depression, but because of sedative properties of this drug, Doxepin can also be used in the management of anxiety and in the treatment of insomnia, where this drug can maintain the sleep and reduce the anxiety. This medication mainly acts on the CNS. Within the CNS, it can improve the transmission of two types of neurotransmitters. One is norepinephrine and second one is serotonin or 5-HT. By improving the transmission of these monoamines, Doxepin can reduce the depression, it can reduce the anxiety, and even it can increase the sleep induction. But for the treatment of insomnia, Doxepin is available as a tablet at low strength. So it is available as 3 mg and 6 mg tablets for the management of insomnia. Whereas for treatment of depression, it can be used at higher doses. So among the tricyclic antidepressants, Doxepin is one of the medications that is used in the management of insomnia. And this drug is particularly a chemical derivative of dibenzoxepine. From this chemical name, we can derive the name of this drug, Doxepin. So Doxepin is a dibenzoxepine derivative. Since this is an antidepressant, Doxepin can also be used for the management of depression, where it is available as a capsules at a strength starting from 25 mg to 75 mg. So at higher doses, Doxepin can be used for the treatment of depression, but at lower doses, it is mainly used in the management of insomnia. Similarly, this drug can also be used for other conditions and it is topically available as a cream. It can be used for the management of itching, dermatitis or neuropathic pain, where it is applied topically to control pruritic conditions. But today in this video, we are going to see how Doxepin tablets are used for sleep management, how it works, what are the important precautions that should be considered, what are the common and significant side effects, how it is given. All these things we will discuss in this video. So first of all, let us see how this drug acts. Doxepin acts by multiple mechanisms. As we have discussed earlier, Doxepin can act on the CNS to improve the transmission of monoamines like norepinephrine, as well as another monoamine is the serotonin. So transmission of norepinephrine as well as serotonin are increased within the CNS. At the same time, Doxepin can act in different ways by blocking the various types of receptors. Doxepin can mainly block the H1 histamine receptors, which may be responsible for induction of sleep, and this drug can also block alpha-1 adrenergic receptors, even muscarinic receptors. All these types of receptors are blocked by Doxepin, so it acts as an antagonist on these receptors. By all of these actions, it can improve the symptoms of depression as well as anxiety. But the main action of Doxepin is attributed to improved transmission of monoamines like norepinephrine and 5-HT. So within the CNS, few of the neurons can store mediators like norepinephrine. This is the presynaptic neuron and this is the postsynaptic neuron. On the postsynaptic neuron, norepinephrine receptors are located. Now, when this norepinephrine is released, it can act on the postsynaptic receptors, which produce postsynaptic excitation. So this results in adrenergic transmission within the CNS. Similarly, another monoamine is the 5-HT or serotonin. This is the presynaptic neuron and this is the postsynaptic neuron, which is equipped with 5-HT receptors. Now again, serotonin can be released and it can act on these receptors, which again produces postsynaptic stimulation. In this way, norepinephrine as well as 5-HT can improve the transmission within the CNS, which balance the mood and behavior in the people. But the release of norepinephrine and 5-HT is controlled by a few of the transporters. One is the norepinephrine transporter, which is present on presynaptic neurons. Similarly, another one is the SCRT, serotonin reuptake transporter, which is again located on presynaptic neurons. Now, these transporters are targeted by Doxepin. In the people with depression, generally monoamine transmission is reduced. In such people, the released norepinephrine is going to be taken back into the nerve terminal by norepinephrine transporter. Similarly, serotonin is going to be taken by serotonin reuptake transporters. So this further reduces transmission of monoamines because their levels within the synaptic cleft is reduced by their uptake. Now doxepin can block this norepinephrine transporter as well as it can block serotonin reuptake transporter. Thereby, it can prevent the reuptake of both norepinephrine as well as serotonin. So the levels of norepinephrine and 5-HT within the synaptic cleft are increased, which improves monoaminergic transmission. Because of improvement of monoamine transmission, the symptoms of depression can be reduced. But apart from these actions, action of doxepin on H1 receptors, adrenergic and muscarinic receptors may also play an important role. Particularly, the induction of sleep may be attributed to the antagonistic action of doxepin on H1 receptors. Even the exact mechanism is not clear, but all these may add to reduce the symptoms of depression as well as insomnia. Now let us the precautions of doxepin. With the use of doxepin, people may observe some abnormal behavior. Because this drug is sedative in nature, it can produce some sleep driving where the people can drive the vehicles with less consciousness and some sedation. And even the people may have abnormal thinking, which may alter their daytime activities. Even this effect is not observed in all the people, but any development of abnormal behavior with doxepin should be thoroughly monitored. Doxepin can reduce the symptoms of insomnia within 7 to 10 days of the treatment. But if you observe no improvement in the symptoms of insomnia, even after treatment for 10 days, then the reason for insomnia may be different, where doxepin is ineffective, and the development of insomnia in the patient may be due to any development of psychosis or depression or any other psychological disorder, which causes disturbance in the sleep resulting in the insomnia. So if you observe no improvement in the insomnia within 10 days of the treatment, then doxepin treatment should be stopped, and any other root causes for the development of insomnia should be thoroughly checked. Another important precaution is that doxepin can act on the CNS and it can produce CNS depression. So doxepin can produce some sedation which may impair the daytime activities. That's why while taking doxepin, alcohol can improve the sedation as well as any antihistamines which are used for treatment of either allergy or cold. If these drugs are combined with doxepin, they can further increase the CNS depression. That's why with doxepin, antihistamines and alcohol should be carefully used, and high intake of alcohol is not recommended. Here we are discussing the doxepin for indication of insomnia at a low dose, but when this medication is used in the depressive patients for the treatment of insomnia, it cannot reduce the depressive symptoms, but instead it can increase the depressive symptoms. So before use of doxepin, the patient should be thoroughly monitored for any existence of depression, because at low dose, doxepin can further worsen the depression, which may increase the suicidal thoughts and suicidal risk. Now let us the side effects of this medication. Since it acts on CNS, it mainly produces central side effects. So doxepin causes sedation, somnolence, sleepiness in the people, nasopharyngitis, cold-like symptoms can be observed, nausea, dizziness, and ataxia, loss of balance can be observed with doxepin. Now let us the chemical nature of this medication. So this is the structure of doxepin. Here we can clearly observe the amine group in the side chain. Let us give the numbering. This is 1, 2 and 3. Simply it is a propanamine with methyl groups on the nitrogen. So NN dimethyl propane 1-amine. Now to this propane chain, a heterocyclic ring is attached at the third position. Now let us give the numbering to this heterocyclic ring. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and 11. So simply this heterocyclic ring is attached by 11th position, and this ring is nothing but dibenzoxepine. Now this dibenzoxepine is attached by 11th position through a double bond. So we can write this as dibenzoxepine 11-iodine. That is the simple name of doxepin. Doxepin is a dibenzoxepine derivative. Finally, let us see how it is given. Doxepin is available in different dosage forms, but for the treatment of insomnia, it is available as a tablet at a strength of 3 mg and 6 mg. The initial dose of this tablet is started at 6 mg, given once daily. But these tablets should be taken 30 minutes before the bedtime because this drug is intended for the treatment of insomnia. At the same time, this drug should not be taken within 3 hours of intake of meal because it may be ineffective within 3 hours and it cannot produce sufficient sleep maintenance. That's why this medication should be taken 30 minutes before the bedtime in order to induce the sleep. And the dose of this medication should be reduced in the elders to 3 mg given once daily because of more sedative effects. So that's all about this medication, Doxepin. Doxepin is one of the tricyclic antidepressant which is having the sedative properties. So it can be used for the management of insomnia, for maintenance of sleep at low dose such as 6 mg. It can also be used for the management of depression at higher doses starting from 25 mg to 75 mg. But for the insomnia, it is used at low dose. Sedation, dizziness, and abnormal behavior are important precautions that should be considered with use of Doxepin. And this medication should be given 30 minutes before the bedtime in order to induce the sleep. And it should not be given within 3 hours of food intake as it impairs the effectiveness of this treatment. So that's all about this drug, Doxepin. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.